people have to put aside a little bit what we've been doing for the last many years and really be able to imagine a new future that'll be better for everyone, where patients will really benefit from the sharing of their information, where physicians will get feedback immediately about their patient and how they fit into other experiences, and then where all that information can be combined to improve health.
I am excited that we are seeing momentum to build on the steps that have already happened. But simultaneously, I want to bring into the discussion a real acknowledgement that rigorous evidence isn't easy to get. And if one has large observational data sets, in fact, you can, if you don't know exactly all the confounds, you can get the wrong answer also. So we need rigor, we need attention to detail, and we need attention to data quality. And some of the time we're still going to need randomization, which is a very good method of reducing confounds and bias.
I think it's bringing together the stakeholders, the leaders of government agencies, manufacturers, physicians, patients, etc., to really rationalize the way we use data to improve the effectiveness and safety of medical products and healthcare delivery in general.
This type of research that we're really focused on with EvGen, it will solve many problems, but first and foremost for me, it'll begin to solve what to do for the individual patient that's best for them.
What I find most exciting about EvGen is its timeliness. Is that we're at this moment where there's so much data being created, and the idea that we start planning now on how we can leverage it is just terrific.
I find the concept of potentially bridging many projects that are already ongoing that have the ability to, one, enhance clinical trials, two, optimize evidence that will allow us to have information to provide better services, not only for healthcare systems, but patients at large.
What I hope we see in 5 years is large healthcare systems coming together to share information for the common good. That's what our patients want, and healthcare systems need to get beyond both the technical barriers, but also some of their traditional cultural barriers about sharing information.
How do I envision the medical evidence generation landscape in 5 or 10 years? I think the first thing is that at the point of clinical care, the care of this person is informed by all the people who had similar characteristics who came before her, and her care is reinvested in an overall system of care. That's what EvGen's all about.
The whole landscape for this is moving very, very fast, and so I don't know where it's going to be in 5 years, but one thing's for sure, there's going to be much more data, there's going to be much more accessibility of the data, and if we don't get things like the interoperability right and the patient centricity of this right, we're going to miss an opportunity to do something very profound to change the ability to treat patients for the next 10, 20, 30 years.
In order for EvGen to rapidly advance, collaboration from multiple stakeholders focused around what patients need is most important.
For the future of EvGen, first we have to be honest in recognizing that there isn't a dichotomy between the research setting and clinical practice setting. It's a continuum. And we have to get our systems ready for that so that we can also learn from what happens in the clinical practice setting.
It's a critical time right now to move EvGen forward. Many people have the same ideas. They'd like to see this happen. For it to happen, though, we need to understand the business motivations. What is it that's keeping people from sharing data? Why is it that clinicians don't have enough time in the clinic to get consent and to operate in a way that gives us answers to critical questions for patients? And what can we do to give patients confidence that the system will work on their behalf and that their data will be treated with respect and confidentiality?